Selling health insurance policies across state lines could be really bad for Minnesota. Right now we have pretty low rates and high quality, and we need to keep the regulation of insurance companies within the state of Minnesota. If the state can't regulate it, it's going to be based on what the Commissioner of Commerce in Mississippi decides is an okay health insurance policy. I'm not sure I want to participate with that. And I will say in the federal bill, there are reform bill that's underway right now. They wouldn't allow state compacts to get together with similarly minded states to regulate health insurance policies. And if we keep our standards up and we don't lower them, then I would support that.
Now, you said the federal law is looking at not allowing states to do that. Why at the federal level are they against that? Is there some sort of mechanism that they see that will make healthcare in worse shape right now than it would be if they allowed the states to work together?
Well, I think the answer is if you have a good comprehensive health policy that you can understand, it's going to cost money. If you have a policy from some other state that is really defective, doesn't cover the same things we do, like there's a whole list of, if you look at Mississippi, they don't cover mastectomies even. Is that really a healthcare policy, or what is it? And we don't need policies like that sold in Minnesota. If states like Wisconsin, Minnesota, Iowa want to get together and have very similar minds about what a good health insurance policy is, I think that's fine, and the new federal law would allow that.
Now, the governor said that there would be the top 20 states included in something like this, assuming that the legislature has a voice in what that is. Would that work? Are there 20 other states in the union that have as good of insurance as Minnesota that we'd want to consider trading with, essentially?
Well, yeah, the top 20, who knows? And then you're going to have our Commissioner of Commerce spending all kinds of time evaluating these policies from outside the state. He's as busy as he can be evaluating policies inside the state. And the public sort of has a general view that we do not allow for-profit companies to compete in this state, and that's not true. We do have for-profit companies, and they have a hard time competing because the three companies that have 80% of our business have administrative costs of about 6 to 8%. Nationally, the average for an insurance company is about 16%. So right away, our Minnesota companies, they take the premiums, they take off 6%, and they send 94% to healthcare providers. In most states, the health insurance companies can't make it on that limited amount of money, so they have to charge more.
You said that there are bits in this plan of Governor Pawlenty's that you found useful, or you found that you might agree with. What are those?
Well, he and I agree that cost and quality are the two most important, and I would also say access. But we need to dramatically change the way our healthcare system is paid, and we need to start paying for outcomes rather than procedures performed. And that is a big change. We have already implemented a lot of that in the bills that we have. We have already implemented, or will be implemented in January, medical homes, chronic disease management. Those are two of the things the governor is talking about, and those will be in place shortly. We passed those bills in 2007 and 2008. If there's other areas where we can combine those things, you bet we should do it. I will say again, the federal legislation may give states some control over how Medicare is reimbursed. And if we can combine Medicare and medical assistance and the private sector going in the same direction, then we can drastically improve the way healthcare is delivered in Minnesota.
Now, the governor, I don't think made many references to GAMC today, General Assistance Medical Care, but obviously that is a topic that many Democrats, I think many Minnesotans are upset about, that he has essentially defunded that program. Do you see that what he's proposing here at all may solve that, or may be a bargaining chip to solve that? Do you see this fitting into that at all?
Well, it certainly does not solve the problem. His veto is $400 million a year for what his commissioner said are the sickest of the sick and the poorest of the poor. These are people that are basically so sick that they cannot work, and they need standard care. Since they do not have kids, they're not eligible for medical assistance. And his veto, as I said, puts the burden on the hospitals. The hospital is still going to treat these people. If somebody shows up and they need care, the hospital is going to give it to them. And if you look at Hennepin County Hospital, the taxpayers of Hennepin County right now are putting about $35 million into the hospital to keep it afloat. After the governor's veto goes into effect, they will have to come up with about another $35 million of property tax money to keep their hospital open. So the governor, while claiming to have gotten rid of this program and saved the state money, he's just dumped the burden on the property taxpayers around the state. They're going to have to bail out their hospitals and keep them alive. Now, what the governor didn't talk about today also is the fact that the federal reform laws that are in play all contain medical assistance coverage for up to 133% of poverty. That would include everybody that we are now on GAMC, and the federal government will pay ultimately 90% of the cost. So we've got a $400 million problem. The feds are going to give us $360 million of that, so we only have a $40 million problem. And again, I think the state of Minnesota should take care of the sickest of the sick and the poorest of the poor.